Hi guys, it's Eric Beard. I just finished teaching a corrective exercise specialist workshop, and one of the topics that was on the agenda was the structure and function of the Adductor Magnus. So I just like to take a few minutes and talk about that. It can be a pretty complicated muscle, and when it's not functioning correctly, it can put excessive stress on all different compartments of the kinetic chain, particularly the sacroiliac joint. It's a muscle that tends to get overactive and synergistically dominant for a weak gluteus maximus. And that, along with the TFL and the piriformis, tend to become dominant around the lumbopelvic hip complex. And then we have all sort of aberrant movement throughout the knee, lower extremity, and lumbopelvic hip complex. Let's start out with when we're looking at the skeleton right here, and then I'll go up onto the board. So the origination for the Adductor Magnus is going to be the inferior ramus of the pubis, the ramus of the ischium, and then the ischial tuberosity. And from there, the fibers are going to run over here to the linea aspera. And then they're going to run all the way down the femur towards the adductor tubercle. But I'll go ahead and I'll just slide that guy out of the way, and I'll go back up to the board here. So this is a posterior view of the skeleton. This would be the right side. Got to be the left side. So when we're talking about, some of the fibers are a little bit more anterior on that inferior ramus of the pubis. Some a little bit more neutral as far as where they're on the ramus of the pubis. But as we come back here to the ischial tuberosity, we'll have the fibers with a little bit more posterior orientation. And they're going to run all the way over here. So they're going to be above that lesser trochanter, attached onto that linea aspera. And they're going to have some fibers that run a little bit more obliquely, like that. They're going to be very strong with their adductor pull or force. You're going to have other fibers that are going to run all the way down that linea aspera, all the way down to the adductor tubercle. This is a significant mass up in the deep groin. So if this is fired up and not working correctly, you're going to feel it. A lot of times people will feel a discomfort or a pull or a strain up in this part of the deep groin, and people confuse an injury with the adductor magnus for a hamstring muscle. Hamstring pulls or strains are usually here on the belly, on the middle of the femur. When we're talking about this deep groin dysfunction, a lot of times it's the adductor magnus, it's a magnus strain. So with this, concentrically, the adductor magnus in the sagittal plane can extend the hip. In the frontal plane, it can adduct the hip. And when the hip is flexed, it can give you some external rotation of the femur. Depending on the position of the femur, you might have different transverse plane impacts on the femur. But most people think of it as just a frontal plane mover. It is an extensor. It's the only adductor within the adductor complex that can extend the hip. And again, if the gluteus maximus is inhibited from a tight psoas or some sort of injury or postural dysfunction, this becomes one of the synergists that takes up the slack, along with the piriformis, and then the TFL tries to provide some frontal plane stability for an inhibited gluteus medius. So this adductor magnus complex can cause a lot of problems, especially with some of the fascial attachments. So from here, from the ischial tuberosity, you're going to have the sacrotuberous ligament as well as potentially the sacrospinous ligament that are going to kind of come up here and thread into the sacroiliac joint and have indirect connections up to towards the PSIS and the SI joint. So if you're having dysfunction, overactivity, abnormal pull, the magnus can have a significant impact on low back pain. A lot of times, sacroiliac joint dysfunction is confused for low back pain, and we looked at some of the research that Sabolka and others have done, is that usually with a sacroiliac joint asymmetry, there is decreased hip internal rotation. And one of the things in the supine position that the adductor magnus can limit, it's internal hip rotation. So during an overhead squat, we might see the knee move in. During a range of motion or goniometric assessment, we might notice a decreased internal rotation from the supine position. We might notice a restriction in the sacroiliac joint, all because of this. We can also throw in here, I wasn't going to talk about the piriformis, but coming anteriorly from the sacrum over here to the greater trochanter, that usually teams up as well. And if we think more anteriorly, then we have the TFL kind of coming down towards the greater trochanter and towards the IT band. So you have these three muscles that can be overactive and synergistically dominant for a weak glute and weak core stabilizers, and can wreak a lot of havoc. So when we're trying to release this muscle, think about the angle, think about getting up into the meat, into the belly, and you can have some nice results. You can work further down by the linea aspera where people traditionally roll the adductors, but think adductor magnus, think about that posterior orientation, think about getting up into the deep groin, and you might have some good results. I'm Eric Beard, thanks for watching, hope you have a great day.